Welcome to the channel, friends, and today we shall be talking about premature menopausal insufficiency. What does that mean? The thought of menopause before the age of 40 is scary, but it does happen. 4 out of 100 women will have premature ovarian insufficiency, which simply means that their ovaries will stop functioning before the age of 40. Why this happens? 90% of the time we don't know. But at the same time, it has got so many implications on a person that we need to know more about this condition, premature ovarian insufficiency. Both the condition, POI and early menopause, leads to multiple health concerns which are short-term as well as long-term in the females. And this needs to be addressed. The females with POI will notice, most importantly, that their periods have stopped. It can be a sudden stoppage or it can be a gradual one, and that must be the only symptom that they notice. But there are other symptoms which also can happen with premature ovarian insufficiency, which is the symptoms of menopause, which is like hot flashes, suddenly feeling too hot and sweaty, and then to get drenched in the sweat and feel cold. They can feel aches and pains and lethargy, mood swings, feeling unloved, and there can be depression. The POI can be gradual or sudden, and it can even happen when somebody is having regular periods. So we just talked about the immediate signs, symptoms of POI, but what are the long-term consequences? It leads to infertility as there are no eggs left for conceiving. It also leads to low self-esteem, a lot of mental agony and depression. It can also cause cardiovascular, and that is, it will make the cardiac health of a person weak, and the heart can suffer because of early stoppage of the functioning of the ovaries, and there's the female hormone estrogen. It also makes the bones weak, which is called brittle bone syndrome. 90% of the time we don't know the reason why somebody has POI, but the known reasons are genetic conditions, like it runs in the family, and genetically they are more prone to have premature ovarian insufficiency. Then there are certain autoimmune conditions. Autoimmunes are where your own immunity, body immunity, is fighting against your body, and that leads to multiple conditions like hypothyroidism, adrenal gland problems, so many connective tissue disorders, and all that can be associated with premature ovarian failure. We also know that people who suffer from cancer, they need chemotherapy and radiotherapy, and that also can cause POI. And last but not the least, there are times when a lady needs surgery where the removal of the ovary is needed. Say for example, in case of ovarian cyst, where both the ovaries are removed, that also will lead to surgical menopause, and which is premature ovarian insufficiency if it happens before the age of 40. There are certain risk factors which makes a person prone to have POI, and that is, of course, anyone less than 40 if has got menopause is called POI, but then the chances of having it becomes more between the age of 35 to 40, so that is higher age. Second is family history. Third is smoking. Fourth is never giving birth to a child. Fifth is hysterectomy. HIV infection is sixth reason, and low body weight can also lead to POI. Diagnosis of POI is difficult because if a young lady stops having periods, doctors or gynecologists don't think of POI as the immediate cause of that stoppage of period. There are so many other various things which are ruled out before one makes a diagnosis of POI. And in case of POI, how do we diagnose it? If somebody has missed the period for 4 months and then she gets a blood test done, which is called FSH, at 4 to 6 weeks interval, and 2 of those tests, if they show that the ovarian failure has happened, then it is a premature ovarian failure, and that is how it is diagnosed. Can we do anything to prevent premature ovarian failure? There are few things. We can be mindful of our lifestyle. We can avoid smoking and alcohol and involve in healthy physical activity. If there is a history of POI, it is a good idea to get it done with the gynecologist sooner than later. And if in case you are having any of the signs symptoms that I have mentioned earlier, like hot flashes, irregular periods, mood swings, do go and visit the gynecologist who can help you out with it. In our next video, we shall be talking about how to manage premature ovarian failure, including the infertility part, as well as what else is needed for the well-being of the lady. Till we meet next time, have a great week ahead. Till then, bye-bye.